Every year, millions of seniors head to their doctors for routine checkups, believing they're doing what's best for their health. But what if I told you that some of those standard tests could actually increase your risk of a stroke, possibly within just a day or two? It sounds shocking, right? After all, you trust your physician. You follow the advice. But hidden beneath the surface of modern medical care are risks that are rarely discussed. Not in news headlines, not in waiting room pamphlets, and sometimes not even by your doctor. Imagine this. You leave your annual physical feeling reassured. But days later, you're hit with dizziness, vision changes, or even worse. You're left asking, how did this happen? Here's the truth. Certain diagnostic tests, especially when repeated too often or performed without considering individual health risks, can lead to sudden blood pressure spikes, disrupted circulation, and in rare but serious cases, a stroke. Now, don't worry, this video isn't about fear. It's about empowerment, so you can ask the right questions, make better choices, and protect both yourself and your loved ones. Because once you're over 60, staying healthy isn't just about catching problems early. It's also about avoiding the ones we might unintentionally cause. In the next few minutes, we'll go over 5 common medical tests that carry hidden risks for stroke, especially in seniors. More importantly, we'll show you how to safeguard yourself before your next doctor's visit. If you're 60 or older, drop a 1 in the comments. If not, type 0, and make sure to subscribe to Elderly Wisdom Insight, where we share the things no one else will tell you. 1. CT scans with contrast. Hidden. Strain on the heart and brain. If you've ever had a CT scan with contrast, you may remember the warm sensation that spreads through your body. That's the contrast to use to make your blood vessels, tissues, and organs more visible on the scan. It sounds harmless, even helpful. But here's what many seniors don't realize. That injection can put significant stress on your cardiovascular system, especially if you have high blood pressure, heart issues, or kidney problems. In some cases, the dye triggers a vasovagal response, a sudden drop in both heart rate and blood pressure, causing dizziness, nausea, or fainting. In other situations, it does the opposite, causing a sharp increase in blood pressure, which can lead to vessel spasms or even trigger a stroke in vulnerable individuals. A study published in the Journal of Vascular and Interventional Radiology found that seniors who had contrast-enhanced CT scans faced higher rates of vascular complications within 72 hours, especially those with pre-existing hypertension, heart disease, or kidney problems. Let me share a real-life story. An 81-year-old man went in for a standard abdominal CT scan due to mild digestive symptoms. The scan showed nothing alarming. He went home feeling fine. But just 2 days later, he experienced a mild stroke. Doctors suspect the contrast dye temporarily spiked his blood pressure, triggering a clot that disrupted blood flow to the brain. Now, this doesn't mean contrast CT scans are bad. On the contrary, they can detect life-threatening issues like aneurysms, clots, or tumors. But they must be used wisely, not just as routine screening. How to protect yourself before agreeing to a CT scan with contrast. Ask your doctor, is this absolutely necessary? Mention any history of hypertension, kidney disease, heart issues, or previous reactions to contrast agents. Ask, is a non-contrast scan or an ultrasound a safer alternative? Sometimes, doctors can get the information they need without contrast, especially for follow-ups or non-urgent cases. 2. Stress tests. Treadmill tests. When pushing the heart pushes too far, the exercise stress test, it's also called a treadmill test, sounds simple enough. Strap on a monitor, walk or jog on a treadmill, and let your doctor see how your heart responds to exertion. For younger people, this can be a useful tool. But for older adults, especially those over 60 with high blood pressure or cardiovascular conditions, this test can place unexpected strain on the heart and blood vessels. Here's why. As you walk and the speed increases, your heart rate and blood pressure rise sharply. For healthy adults, that's manageable. But for seniors with fragile vessels or heart disease, this can trigger dangerous blood pressure spikes, irregular heart rhythms, arrhythmias in rare cases, small vessel ruptures, or stress-induced clots, especially in the Brain A 2020 study. And the American Journal of Cardiology tracked over 1,300 adults aged 65 and older who underwent treadmill stress tests. Nearly 7% of participants experienced complications during stress testing, including blood pressure spikes and irregular heart rhythms, and the group most at risk, those who already had pre-existing vascular conditions. And this isn't just data, it's reality. Take Margaret from Ohio, one of our longtime subscribers. She's 74 and has been managing high blood pressure for years. Her doctor suggested a routine stress test, just to be cautious. But halfway through the treadmill portion, Margaret started to feel dizzy and noticed a tightening in her chest. The test was stopped immediately. Unfortunately, the very next day, Margaret suffered a minor stroke. Doctors believe that a sudden spike in her blood pressure during the test may have caused a tiny blood vessel in her brain to rupture. To be clear, the test itself didn't directly cause the stroke, but it placed unnecessary stress on a system that was already fragile. That's what tipped things over the edge. So what's the key takeaway? Have an honest conversation with your doctor. Ask, is there a safer way to assess my heart function? In many cases, a pharmacologic chemical stress test, which uses medication instead of physical exertion, or even a resting echocardiogram, may be safer choices for older adults. And if you're not experiencing symptoms like chest discomfort, breathlessness, or fatigue, it's perfectly fair to ask, do I really need this test right now, or can it wait? Now let's move on to another procedure that's become almost automatic. After a certain age, the endoscopy. Whether it's a scope of the esophagus, stomach, or colon, these procedures are often suggested just in case. And while they can be valuable, they also come with hidden risks, especially when sedation is involved. Here's the problem. Most seniors are on medications, especially blood thinners like warfarin, aspirin, or Plavix. During sedation, blood pressure and circulation naturally drop. Combine that with medication that thins your blood and you could be looking at an increased risk for internal bleeding or disrupted brain circulation, which can lead to a mini-stroke. In fact, a 2021 review published in the journal Gastrointestinal Endoscopy found that among patients aged 65 and up, sedated endoscopy procedures were followed by a noticeable rise in transient ischemic attacks, TIs, more commonly known as mini-strokes, within 72 hours. These weren't major strokes, but they were clear red flags that blood flow to the brain had been compromised. One memorable case. A 76-year-old woman underwent a routine colonoscopy under sedation. She had no symptoms beforehand. But just 2 days later, she began slurring her words and had difficulty walking straight. The ER confirmed she'd suffered a mild stroke. Doctors believe that a drop in blood pressure during sedation, combined with her daily aspirin use, may have allowed a small clot to move into her brain circulation. So even though these procedures are generally considered low risk, the combination of age, medications, and sedation can create a perfect storm. So what should you do? Before scheduling an endoscopy, ask your doctor, why now? Is there a specific concern, or is it just routine? Mention all medications you're on, especially blood thinners. Ask, will I need to stop my medication before the procedure? What are the risks of sedation at my age and health level? If you're uncomfortable with sedation, ask, can this be done with minimal or no sedation? Next, let's talk about a powerful diagnostic tool that many people trust without question. The MRIs are incredibly useful. They allow doctors to see detailed images of internal organs, tissues, and structures often catching problems early and avoiding invasive surgery. But when contrast dye is added to the procedure, things can get more complicated, especially for seniors. The contrast used in MR often contains gadolinium, a heavy metal designed to leave the body through your kidneys. But here's the catch. After age 60, kidney function naturally slows, even if you feel healthy and if you already have undiagnosed or mild kidney disease. Your body may not filter the gadolinium out efficiently, causing it to linger over time. Residual gadolinium in the body has been linked to a condition known as nephrogenic systemic fibrosis, NSF. This rare but serious disorder leads to the thickening of skin and connective tissue. In severe cases, it can affect movement, breathing, and even organs. And there's more gadolinium. Retention has also been found in brain tissue. Some researchers believe that this buildup may be connected to subtle neurological symptoms like dizziness, brain fog, and confusion, especially in people already at risk for circulatory or vascular issues. A 2019 study in the journal Radiology followed over 2,000 adults aged 65 who received MR with contrast dye. Within just a week of the procedure, around 5% of patients reported stroke-like symptoms, things like headaches, blurry vision, trouble with balance. These weren't full strokes, but they were clear warning signs. Here's what's important. Most of those affected had undiagnosed or existing kidney problems. Take Harold, a 79-year-old veteran from Arizona. He'd been dealing with persistent back pain, so his doctor ordered an MRI with contrast to be thorough. Harold didn't know he had kidney issues. 2 days after the scan, he began feeling lightheaded, foggy, and weak symptoms that lasted nearly a week. When his primary doctor ran some tests, they found out Harold had stage 3 kidney disease. "Nobody told me," he said. "If I had known, I would have asked more questions." So what can you do? If your doctor recommends a contrast MRI, ask, "Can this be done without the dye?" In many situations, the answer is yes. If contrast is absolutely necessary, ask for a kidney function test first. It's a simple blood test called AGFR, and it helps make sure your kidneys can safely process the dye. Also, let your doctor know if you've ever had unusual reactions to scans or imaging in the past. The MRI itself isn't the issue, it's the chemical contrast agent that might not clear out properly. With the right precautions, you can still get the diagnostic answers you need without putting extra stress on your kidneys or brain. Now, let's move to another test that seems harmless, maybe even responsible to do regularly, but may be leading many older adults toward risky surgeries they never really needed. We're talking about the routine carotid artery ultrasound. It's painless, non-invasive, and only takes a few minutes. No needles, no loud machines. Sounds like the perfect preventive measure, right? But here's what most people over 60 aren't told. If you have no symptoms, your doctor is just ordering it as a precaution, this test might lead you down a path to surgery you didn't actually need. Carotid arteries are major vessels that deliver blood to the brain. And, as we age, it's completely normal for some plaque buildup made of cholesterol or calcium to develop. But here's the catch. Not every bit of plaque needs to be removed. In fact, many cases, it's safer to monitor it than to operate. Here's how unnecessary intervention can happen. Your scan shows 50 to 60% narrowing. That sounds scary, so your doctor refers you to a vascular surgeon. Suddenly, you're being told to consider a carotid endarterectomy or a stent placement. But if you haven't experienced any symptoms, no dizziness, no vision problems, no weakness, none, you might not benefit much from that surgery at all. In fact, a large study in the New England Journal of Medicine followed over 3,000 seniors with moderate carotid narrowing, but no symptoms. The results? In most cases, medications and lifestyle changes were just as effective as surgery at preventing strokes. Worse still, a small number of patients actually had strokes due to the surgery itself, during the procedure, or during recovery. One story we won't forget comes from Helen, 82, from Pennsylvania. She went for a checkup, felt totally fine, and agreed to a carotid ultrasound because her doctor wanted to be cautious. It showed 65% narrowing. Within weeks, she was in surgery. Sadly, during the procedure, Helen suffered a minor stroke. She survived, but now lives with partial weakness on her right side. She told us, "I wish someone had told me that doing nothing might have been safer." So, what should you do if your doctor suggests a carotid ultrasound and you're not having? Symptoms ask, what are we looking for exactly? If we find something, what's the next step? You want to know? Will this test actually change your treatment or just add stress? And if you're already taking medications for blood pressure or cholesterol and following a healthy lifestyle, a test like this might not make much of a difference. Already had a scan showing some narrowing. Don't panic. Ask if it can simply. Be monitored with periodic follow-ups instead of immediately heading to surgery. And always get a second opinion before agreeing to any vascular procedure. Let's wrap this up with a little encouragement, an important reminder. Not every medical test is dangerous. But not every test is necessary, especially after 60. Our bodies change. What once seemed routine like a contrast injection, sedation, or a quick scan can sometimes have unexpected side effects, particularly when our system is already vulnerable. A simple injection might spike your blood pressure. A scan might trigger a reaction. Even a short procedure can carry risk when it's not tailored to your health needs. That's why it's so crucial to pause. Ask questions and advocate for yourself. Ask, is this really needed? Say, can we consider a safer alternative? Because informed decisions lead to better outcomes. Peace of mind, your story matters. Your voice matters, and here we believe every health choice should be based on understanding, not fear or habit. If you've ever had a strange experience after a test, or watched a loved one face something unexpected, drop a 1 in the comments. If not, post a 0. Let's learn from each other, share, and stay connected. And if this video gave you clarity, confidence, or simply made you curious, don't forget to subscribe to Elderly Wisdom Insight. We're here to ask the tough questions, reveal what others don't, and always put your well-being first.